Could a person who seems healthy actually have kidney problems? And should you be concerned with your kidneys? Did you know that 1 in 3 adults who have a severe case of chronic kidney disease don't even know that they have it? And did you know that 9 out of 10 people who have chronic disease don't know they have it either? It's kind of a silent epidemic. In fact, it's estimated that about 14% of the US population has it. Now, first of all, let's talk about what the kidneys do for you. The kidneys purify the blood. It basically filters waste out of the blood and empties it out through your urine. The kidneys help to maintain the electrolyte balance in your body, as well as the minerals. They regulate your pH, as well as your blood pressure. They make red blood cells and help to maintain balance of fluid in the blood and the cells. Elderly people are more likely to have chronic kidney disease at rates as high as 34%. Why older people, you might ask? Well, it's accumulated kidney damage that happens over the course of their lifetime, and that damage adds up. Surprisingly, it's quite easy to damage the kidneys. The National Kidney Foundation has identified some behavior that's damaging to the kidneys, including using over-the-counter painkillers, NSAIDs, non-steroidal anti-inflammatory drugs like Aleve or ibuprofen, having high blood pressure, drinking cola beverages, smoking, regular drinking, too much and too often, regular heavy drinking. Regular heavy drinking actually doubles the risk of chronic kidney disease. And if they smoke as well, that is 5 times the risk. And of course, binge drinking, because the more alcohol you drink, the more you damage your kidneys. The kidneys have to maintain balance of fluid and cells within the blood. So all of these risky behaviors, they make sense as to why they would damage the kidneys. When moving forward in life, remember, stay cognizant of the function of your kidneys and ask yourself if what you're doing is promoting your kidney health or damaging it. There are 2 things to remember in order to maintain kidney health. Number 1, drink adequate amounts of water to maintain kidney health. Monitor the color of your urine every time that you urinate. And when you have supplements that you're taking, on the bottle of those pills, it tells you drink with 8 ounces of water. When it tells you to do that, actually do it. Don't just take a swig and swallow the pill real quick. Make sure you drink enough water because you do not want to overwhelm your kidneys. Number 2, when you feel the need to urinate, go to the bathroom. Stop putting it off. Do not hold your pee. Do not hold it. When you feel the urge, listen to it, go ahead and do what you need to do. Holding your urine can result in UTIs, enlarged prostates, and bladder and kidney issues. You don't want the urine to overflow to the point where now it's going back up in places it's not supposed to be going back up into. When your body needs to release something, you need to allow it to release it, especially toxins, because the kidneys filter toxins and flush them out of the body. And if you cannot flush them out of the body, you're keeping the toxins in. Trust and respect what your body is telling you. When your body says that urine needs to be released now, listen to that. Go immediately, dismiss yourself, and release the urine. Now, on this kidney note, did you know that lean people need to lose weight too? The shape of our bodies is more reflective of the state of our health than the actual weight. The problem happens when we accumulate too much belly fat. Take a look at this study. A central body fat distribution is related to renal function impairment, even in lean subjects. People who had more belly fat had a higher risk of diminished kidney filtration, regardless of whether they were obese, overweight, or lean. This is why it's more important to look in the mirror or measure your waist rather than stepping on a scale and just deciding that you're going to lose a certain amount of pounds. Regardless of BMI, the higher the waist to hip ratio, the higher the risk of diminished kidney filtration. When we do things, we need to think about the health of our organs. We have to think about what we're doing, whether it's health promoting or disease promoting. Sugar consumption. Sugar has been shown to have a causal effect on different risk factors related to kidney damage. That means that it can increase your risk of developing chronic kidney disease by increasing your risk factors for chronic kidney disease. Risk factors including diabetes, obesity, and elevated serum uric acid levels. There are multiple epidemiological studies, well, they're like population studies, that have identified sugar to be a likely cause of chronic kidney disease. This has also been found for diet soda, which uses artificial sweeteners. So sugar, artificial sweeteners, throw them all in the same bucket together. In terms of damage to the kidneys, high fructose corn syrup and sugar are also speculated to be equally damaging because they're both similar to each other in structure. So, again, when you go through your choices every day, make sure to consider whether what you're doing is going to be harming your organs or benefiting them. Another thing to consider is avoid touching surfaces, consuming food, or drinking fluids that have been contaminated with the most commonly used pesticide, glyphosate. In Sri Lanka, there was a spike in chronic kidney disease among farmers and their children who lived in rural areas. Nobody knew what was causing these cases to pop up. So the researchers decided to test their wells to see if there were any kidney damaging contaminants in there. Now, because the wells were hard water wells or mineral rich wells, the combination of the hard water with the glyphosate and fluoride made it contaminated. Glyphosate as well as fluoride have been found to increase the risk of chronic kidney disease. These two things were found in a dose response, meaning that the higher amounts of glyphosate, the higher amounts of fluoride, the higher the chances of chronic kidney disease. Glyphosate is supposed to dissolve after a few days or a few weeks, but because of interaction with metals and other materials in water, it sticks around for 7 years. And in the soil, up to 22 years. Now more than ever, we need to start relying on organic farms and we need to start growing our own produce. So thank you for watching. You can get my book, link in bio. It explains the connection between the size of our wastes and the state of our health and what we can do to take power and control back over our health. Another thing is if you don't have any recipes, I've made a little recipe book. It's plant-based and vegan and oil-free. That can also be found, link in bio.